Good morning and welcome to the Independent Scientific Advocacy Group seminar, public press conference. We are talking today about the current situation in Ireland and the situation we're facing into and what we might expect. So this is going to be brief on our part. We very much welcome questions and that we would like that to be the bulk of today. We are very happy to take questions from the public. And in fact, if there are any journalists present who would like to ask a question, and if they wish, we invite you to use the raise your hand function, and then we can actually activate you so that you can speak for yourself, introduce yourself and ask your question. We welcome journalists to do that. Otherwise, other attendees can please use the question and answer function. So we'd very much welcome questions and interaction today. So as usual, we're going to start with a situation update on the current status of the pandemic in Ireland and the case numbers. And for that, I'm handing over to Paul Dempsey.
Good morning, everyone. Just looking first of all at the situation in Northern Ireland, their vaccine rollout has shown some great benefits in the older age groups. So just before we go into it in detail, just to remind people from previous weeks, the scale we tend to use here is a logarithmic scale because it's what the virus tends to grow over. So instead of going from 1 to 3, we'll go from 1 to 2 to 4 to 8 up along these axes, and it means we can fit everything and compare them in the way that the virus grows. So we can see here that the older age groups who've been largely vaccinated have split away from the rest of the trends, and they're heading down quicker than everybody else, which is exactly what we expected. In previous weeks, we also showed healthcare workers versus non-healthcare workers in the Republic, but in the last couple of days, there hasn't been as much testing in the Republic, so the healthcare workers haven't shown up to make that comparison. When we look from a regional perspective around Ireland, we've all in recent days seen that Cork and Kerry previous weeks have been in really well compared to everywhere else. Now, one of the large reasons for that is 96% of the population of Cork and Kerry work and live and everything within that bubble. So once you're in Cork and Kerry and the cases can be kept low, it's more manageable. The cases that tend to come in have an effect like imports would have in a big country. So where Cork could have been going on a trajectory down into a containable zone by now, the fact that the rest of the country is still able to go there for work, even in small numbers, 1 or 2 imports is enough to prevent it from going. In the last couple of days in Cork and Kerry, we have seen what looks like either an effect due to reopening of schools or maybe St. Patrick's Day, but because everything was so on top of each other, it's impossible to tell the difference. But there is signs that it's coming back down again. When we try to compare the country, so we know the average number of cases we've had going on at the moment, but if everybody was like Cork and Kerry, we'd be looking at 200 cases a day, whereas if everybody was like Dublin, we'd be looking at 700 cases a day. So there's a very big variation around the country, even as we speak. When we go through looking at the age profiles, again, the difference here is between, say, 650 if we were if everyone was like the 15 to 24 groups versus 440 if everyone's like the younger groups. And again, similar patterns across everything, nothing too spectacular. We had a big increase when the first round of primary schools and Leaving Cert happened, but especially with the school closures now, things have settled back down for the last little while. And again, we're seeing some degree of benefit in our oldest population, where the 65 plus have dropped down to a level that we would be more encouraged by if it was for the rest of the population. That's just in Ireland. When we're looking at our threats from outside, we also have to look at what's going on in Europe at the moment, where some of the variants of concern from the Southern Hemisphere have made it to Europe and are at high enough levels. So if we look at France over the last 14 days, they've had about 530,000 cases of COVID in total. Around 5% of them are either the P1, which is what was originally found in Brazil, or B1351, which is originally found in South Africa. What that means is roughly 1 in every 800 to 2,500 people in France have a variant of concern that we wouldn't particularly want spreading in the community here in Ireland. On the other side, we want to look at the good news stories internationally will be Israel, who have had a very aggressive vaccination policy where they bet everything on Pfizer early on, and it's paid off for them. They are by far the highest portion of the world where they have the population fully vaccinated. Next to them is Chile, then the US, and then the UK. Fully vaccination means we'd expect to see some transmission effects as well. The benefit is showing for them. They have an R value, so this idea of how many people are infected from each case is really, really low. It's in line with what we would have had last April in our first elimination of the first part of COVID. Compare that though with Chile and the US, they're about the same as us. Chile are in a bad state because they've opened up too quickly in their vaccination policy, whereas Israel had a more conservative approach. And France, again, while they have quite a lot of variants, they're still in a very strong growth phase there as well. Again, looking at Israel, we can see how this R value plays out. We've got this massive drop since in Israel in the actual cases per million. They've dropped below the UK and ourselves, whereas some other countries are definitely not doing as well. In fact, Ireland are definitely doing one of the better countries in Europe at the moment. A lot of other countries have a very fast accelerating problems between B117 and other variants of concern. Now, despite all this, Israel is still taking an approach that we don't want to let this back in. So Passover, so like Easter, is over there when they're going back to school, but schools will not be fully open. They're only allowing the younger age groups back into school, and their leaving cert equivalent are only being allowed in-person classing if 90% of that class has been vaccinated. Like with Israel, I think today they're opening their borders properly. And that will involve allowing people who are vaccinated into the country, but they have to do the 14-day mandatory quarantine period. Okay, that's stuff from Ireland and abroad. Passing on.
Thank you, Paul. That's very useful. It's very interesting, and it's very encouraging to see the effects, the very positive effects of vaccination. And I think, in what has been a very bleak year, the power of the vaccine program is giving everybody a bit of a lift. So thank you for that information. So now I'd like to invite Professor Anthony Staines to give us a brief comment as well. Anthony.
Thank you. Thanks very much, Eva. So as has happened on a couple of occasions before, we're at another crossroads in this condition. As I think Paul has shown, we have persistently high numbers of cases. We are not doing nearly as badly as we absolutely could. We are not doing nearly as well as we should. We know the variants of concern are in our country, circulating at a low level. We hope that will continue. But we have choices to make now, and those choices will determine pretty much what happens over the next 6 months. The vaccination program is going well, and there seems to be very substantial public support for vaccination. Very few people are turning down the opportunity to be vaccinated. And if that continues, and if vaccine supply continues, we could expect to have a substantial proportion of our population vaccinated by the early autumn. And that will make a very big difference to the number of cases, providing nothing else changes. We're fairly confident that the vaccines we have now will provide really high levels of protection against the strains that are circulating now. We're not so confident they will provide the same levels of protection against some of the newer strains. They will surely provide significant protection, but we don't know how much. And we do not want to be in a position where we find out how much protection they offer. We want to ensure these strains do not get a foothold in our community and that they're controlled and kept out of circulation so that we can get our lives back to normal. And that does depend on bringing case numbers down. The government's official policy is strong suppression, and we would strongly encourage that, because clearly to get to zero, you have to have strong suppression first. But we're not going to get strong suppression just by saying it repeatedly. We're not going to get strong suppression just by continuing a varying lockdown for, I think at the moment, the indefinite future, certainly till autumn. If we want strong suppression, we will have to achieve it. And that means using all the tools we have at our disposal. It means having working ICT systems so public health can do their job. It means having enough bodies so we can do full source investigation to find out where people are getting infected. And we can do full contact tracing. So we identify all the people you've been in contact with from the earliest time you could have been infectious to the time at which you test. And we have to bring in supported isolation. Before the seminar started, we were having a conversation about sick pay in Ireland. It is incredible that a year into a pandemic, we still do not have statutory sick pay for people who are waiting to be tested, people who are required to self-isolate. That's absurd, but that's the situation we're in. So we're making choices, and we will get the benefit of the choices we make. And I would urge all of us to choose to bring these viruses under control as quickly as possible, to ensure that we do not find out whether the new variants of concern can cause problems. We do not test the ability of the existing vaccines to control new variants. We control this virus and bring it down. And as we see the long-term impact of COVID becoming clearer and clearer, the pressure to do this must surely become greater. So it's time for some choices. I think we need to make those choices now. Thank you.
Thanks, Anthony. It's very striking, actually, that the things we're still lacking are the obvious things that we and anybody involved in public health has been asking for a long time. And just to say, like, you make the point there, it's time to choose, but many of these things are not individual choices. It's the government that has to put these things in. So that's important. It's I can't choose to have sick pay. It has to be, and I can't choose that people have proper places to isolate when they need to isolate in order to limit transmission and break chains of transmission. It is striking that repeatedly we've been asking people to do things, but not enabling them to do it, and then pretending it's their fault that these things don't happen. But thank you very much for that, Anthony. So now I'd like to move to Gabriel Scally. Sorry, just been Gabriel. And it's great to have you here, Gabriel Scally, and to hear your views. And after this, we'll be taking questions. And I'll just repeat, if there's any journalists who'd like to raise their hand, we can activate your camera and you can ask your question that way if you wish. Thank you, Gabriel.
Thank you. It's a pleasure to be with you. I think we are at a most interesting phase in this terrible pandemic, and it's one of the most complex phases I think we've seen, and it's a really difficult thing to think your way through that, but the only way you can really do that in terms of the safety of the population is think about it in terms of public health and what should be done. One of the things we absolutely need is a strategy. It isn't good enough to have really, really important debates playing out amongst politicians and others day by day in the press. We should have a strategy which lays out quite clearly what the government is going to do. We are all going to be expected to do to keep the virus, to get the virus down, to keep the virus down and to keep new variants out. Those are the key things that we need to do, and we need a strategy how to get there. Some of the key elements of that are the basics, and as I said, it's not possible to entirely predict how this will go. One can see countries like Chile, which, and I think Paul showed the data for Chile on one of the levels of vaccination. They're doing very well in terms of vaccination, but they're having the most enormous wave of cases, and their hospitals are overflowing with patients at the present time, despite having 20% of the population vaccinated. So it's entirely possible that this all could go wrong. So what are the sort of things we need to do to make sure it doesn't go wrong for us? Well, one is to continue the vaccination program to get as many people having at least one shot of the vaccine as possible, as quickly as possible. The second thing is we need to control the virus and get the levels down. So to do that, we do need to continue with some degree of social restriction. And in order to do that, it does require everyone to have the belief that it will work, and it will work. It's off it's been the policy of Independent SAGE for some time that this should and quite possibly could be very successfully done at a geographic level by the creation of green zones, which get the virus down to zero and keep them down. Keeping it down is the really difficult thing, particularly if there is any relaxation in some of the issues around movement. And one of the most important things that we have to do is keep more of the virus out. We've seen two examples of what can happen in Ireland if we don't keep the virus out. At the end of last summer, when the Spanish variant came back with a lot of people from abroad or with visitors from abroad and became very rapidly the dominant variant. Or around the Christmas time with the really tragic decisions to loosen restrictions and to permit widespread travel at Christmas. And we saw the UK variant coming in, much more infectious, probably much more lethal as well, and has become the dominant variant and made all our lives much more difficult than they needed to be. And there are variants now popping up across the world that are of significant danger to us, and the biggest danger, and it's the risk that we must avoid at all costs, is a variant getting to Ireland that can dodge the vaccine, is not only just more infectious, but isn't affected by the immunity given by the vaccine, and that's what we must avoid. That will become easier as more countries get vaccinated and more countries get the virus under control. But in the meantime, we should not be permitting people to travel to and fro easily from this country. People can't travel to and fro within their own counties yet even. And it is very strange that it should be considered acceptable at all for people to travel to Ireland, irrespective of what their passport says. In terms of where the passport was issued, and also what their travel documents say, because they could have come via a travel hub anywhere in the world from anywhere in the world. The only safe way to keep the population safe from new dangerous variants is to have a managed isolation system that includes everyone. And the best way to organize that is for a capacity analysis to be done of the number of people that can be dealt with arriving every day in Ireland and passing through the isolation facilities, and advanced registration for that. Doing it on the basis of this country today or that country tomorrow will not work, and it will not keep the variants out. And the final point I want to make is, at the back of it all, the thing we rely upon are very good local public health resources, because irrespective of what happens, there will be flare-ups in this virus, there will be local outbreaks, and there will be illness in our communities. It'll pop up, and we are totally reliant upon the public health teams at a local level to bring that under control and to make sure it doesn't spread any wider, and to contain it and drive it down, suppress it within those communities. So the resources for the public health teams are extraordinarily important. It is way, way, way beyond time that in Ireland, the public health staff and the public health doctors leading those teams should be properly recognised, properly resourced, and properly supported by us all. It's scandalous that it hasn't happened yet, and it should happen now, because we're going to need them for at least the next year or two, and also to form our backstop for the future as well. So it is an investment in the future to get it right now. But there is a way forward, but we do need a strategy that encompasses these things that ISAG are recommending. I think everyone knows that if many of the things ISAG has been saying from its inception had been done, we would have saved many, many, many lives and much illness and long COVID and the disability that goes with it. Now is the time to put those principles down in terms of a strategy for the country and enact it. Thank you very much.
Thank you, Gabriel. Yes, we are sorely lacking in a proper strategy, unfortunately. So there's a question here that I think leads on very naturally from that, and I think I'll direct it to you, Jerry Killeen. It's with regard to NEFIT's modelling and the predictions that NEFIT has made, and essentially that under their scenarios, they don't see us getting the numbers down again. And I just wonder, could you comment on that? Sorry, Jerry, you're still muted.
Sure, thank you, Aoife. I think, you know, I've got the letter, NEFIT's last letter to the Minister for Health here. It's 27 pages. I broadly agree with what's in it in terms of caution and warnings. In fact, I would just say that maybe some of the simulations lean a little bit on the optimistic side, and that the language could be a little bit plainer. However, what kind of really depressed me is what's missing. What's missing from this letter is hope and ambition. It's a white flag. We're left with no alternative to a fourth wave. The only modeled scenarios are reproductive numbers above 1. And so there's no projection of an alternative that we can all get excited about, an alternative to a fourth wave. And, there's no technical basis for that. Cork and Kerry have proved that, right? The second thing that's missing is, the kind of concrete ambition that's required for a robust elimination plan that protects us against new variants, more transmissible variants, possible vaccine resistant variants over the medium term. And what's really gets me down is the missed opportunity to seize the new, those new opportunities that arise from having these vaccines. There's a whole bunch of things that these vaccines make easier. Overall, it just makes elimination an easier plan, easier thing to do. So instead of looking at this as an opportunity to finish the job and then keep ourselves safe over the medium, to long term, we're looking at this as a kind of a defensive plan over the next, few months. And we're missing really opportunities to go after things. Even vaccine-resistant variants can be tackled by public health so long as we can see them as being the only cause of outbreaks. As long as they're lost in an ocean of lots of different kinds of variants, then we're going to miss them. So there's so many ways that we could be out of this by summer, and we could accelerate our trajectories. We could all be on Cork and Kerry trajectories if we just had the ambition, took all the opportunities that are there through finally releasing our public health doctors, through making use of ventilation, through smart use of rapid testing. I could go on and on and on. They're all things that we haven't done yet. So imagine where we could be if we just got past this sense of defeatism. People need leadership and building on success. So the Cork-Kerry experience for me really takes me back to my days in Dar es Salaam, where we were given what seemed like an impossible task. But where did we start? We started in the wards that had the best teams and were the most successful. Once they were really chasing the mosquitoes out of town, we then scaled that up and up and up and up. And eventually some species of mosquitoes just disappeared. Now, people told us it was impossible at the start, but it wasn't. We need the same. I come from a Munster rugby background, and I'm a strong believer in the kind of stand up and fight ethos. For me, this letter is a white flag.
Thank you, Jerry. Yes, I think it is important not to give up, and it's worth noting, as many people have, this isn't even the worst possible pandemic that could happen. If we give up now, what does that mean for future preparedness? So there's a few questions coming in with regard to schools, so I'll try and combine these. There's multiple people asking about there's the full return to school is anticipated for coming Monday, but people are asking about that the guidelines for safety in school are quite flimsy, that the point of ventilation Jerry just mentioned there, that this is not really clearly has not been clearly laid out what is adequate ventilation. There are no CO2 monitors. There's somebody saying that there's large student populations, minimal social distancing, and asking about the health risks to both the teachers, some of which are in their 60s, of course, and the student population themselves. So is there anybody on the panel who would like to address the point of safety in schools and the return to schools? Gabriel, please, thank you.
Yes, thank you. I think it's such a vital point, and not just schools, if I could link it also with workplaces, because the issues are exactly the same. They are about safety and the safety of people. And we do know absolutely definitively that air movement and fresh air is extraordinarily important. That's just been very, very well scientifically demonstrated in terms of the spread of the virus. Now, we can't conduct all school activities outdoors or all employment activities outdoors, but what we can do, it's within our technical competence and has been for centuries, to be able to properly ventilate spaces that people are in. And it's not difficult. It does require time and effort and a bit of money, but it's not enormously expensive. But what it does need is a clear impetus from the top. And I personally, I would like to see ministers and the Taoiseach saying that employers and school management must make sure that there's an adequate supply of fresh air via ventilation in all enclosed areas. That must be present. And I would also look to the trade unions, to student unions, and to workers and students themselves, where they're able to, in discussion with their parents, to make very clear that they expect to be safe when they are in schools or universities or workplaces. They've a right to be kept safe, and that right isn't being respected at the present time, and it really, really needs to be.
Thank you, Gabriel. So there's a question here about the mandatory hotel quarantine, in particular about the questioner is asking about the fact that the government is fighting over which countries to add and not to add. I think we kind of generally know among this group, we seem to, I think we all share the view that this should be, to be done well, it should be every country that's on that list. But does anybody want to comment on this in particular? Jerry, please.
I think my simplest analogy would be it's like two people living in a paper house arguing about how many sparks they can afford to let in through the window.
That's pretty depressing. Let's hope that they see sense. Gabriel.
Yeah, I think it's really important. I mean, I'm like many Irish people, have a strong sense of history, and I've looked back at the history of quarantine on this island. And one of the last acts of the Irish Parliament in 1800, before it was abolished, was to pass a Quarantine Act, which they did in a time scale that makes the current time scales for legislation getting through the door look positively glacial. And also, it illustrates, when you read that Act of 1800, how seriously they took quarantine then to keep plague out of Ireland. And it wasn't a question of where the people had come from. It was a question of the safety of the population. The safety of the population was paramount, and people and ships and goods were put into isolation until it was perfectly clear that they weren't infectious and were not going to cause outbreaks of plague on the island. And it's amazing, more than 200 years later, we still have a failure to understand the importance of quarantine, about managed isolation to ensure that this virus and its dangerous variants in particular are not brought amongst us. And for me, it's a very plain and simple matter. As long as we need to keep these variants out, we do need a system whereby people will be in managed isolation safely, and that will keep not just them safe, but it'll keep the population safe.
Yeah, and of course, I mean, we recognize that the quarantine is a huge inconvenience, but it's a huge inconvenience on the minimum possible number of people in order to maximize the freedom for the rest of the population, because we are all suffering with huge inconvenience at the moment. There's a related question then has come in. If anybody would like to address what would be a worst case scenario if a vaccine resistant variant did enter the country and get established. Just wondering who would like to. That's a tricky one because we're predicting the future. Jerry?
Yeah, I don't think we need to entirely predict the future. We just need to look a little bit further than our own borders. I've been following what's happening in Brazil for quite some time because we have family links into there. And anybody who's followed where P1 came from in Manaus, the story in Manaus, how the story in Manaus has turned into the story in Brazil, And the grim reality that, Brazil it's not just where Brazil is today, it's where Brazil is going is an example of how bad it can get. They broke the 4,000 deaths a day mark in the last couple of days, but that's a near vertical trajectory. And from what we know from speaking to friends and family is that Brazil is ready to roll over. There's only so much you can do, and people should be aware that every time there's a new variant, people like Paul and myself and other people like us have to recalculate our models and ask ourselves the question: is this containable? Now, the day might come, and it's not so far away where people ask us, is this containable? And we have to say things like, I don't know. And, B117 took us to a reproduction number of about 6, a base reproduction number of about 6. If we ever get to 8, then I don't know.
Okay, yeah, so let's hope we don't have to face into that scenario. But so related to that, on the vaccines, I think I'd like to address this one to Sam McConkey, if I could, but just generally a view on the vaccines and in the context of the current situation, and also, of course, the variants of concern that we know about.
Yeah, so I suppose I'd like to restate some of the positives, Aoife, about vaccines, which is that, as we saw earlier, really good data from Israel that there's population level control when you get these high levels of vaccination. 2 doses of the Pfizer vaccine have worked. Similarly, in Scotland, they've really improved where they were at with often just 1 dose of the AstraZeneca vaccine has helped them. We also had data in end of March from US healthcare workers showing that 2 doses of vaccine prevent you getting asymptomatic transmission, and therefore you're no longer likely to be a vector of COVID to other people. And that's particularly important for healthcare workers and those of us caring for vulnerable others, or even in schools, that you don't want to be passing it on to other people. So I think I'm sort of humbled and delighted at just how fast we've got several vaccines that work, and I'm slightly dazed at how good they are. Not just in phase 3 clinical trials, but in the real world setting, we're still getting levels of 90% efficacy, which, is better than several other vaccines, like BCG that we've been using for years. So I think there's a very good story with vaccines. Of course, the worry is that we find a variant, as Jerry's been saying, that escapes the control of the vaccine. Now, that's a very big problem because it won't work. Now, I hope then that the vaccine companies would make a new vaccine that would cover those strains, as we do with flu every year, but that would take 6 months again, or some period of time, and we'd all have to be revaccinated and a scramble to get it. So I do see the vaccine, this widespread rollout of vaccine, as a real step forward, and I'm really pleased to be at that stage. Earlier on, I'd said it could take 3 to 7 years to have a good vaccine against this, and I'm delighted to be proven wrong.
Thank you, Sam. So we have a question from Rachel Lavin of the Sunday Business Post asking, is there a 4th wave currently happening in Irish schools? I wonder, Paul, would you be able to answer that question?
This is one of the ones where we go with the Jerry's. We don't know right now. It's not clear either which way. It's on a balance. We have this break, and of course the schools aren't really starting fully, the secondary schools, until next week. The primary schools definitely got away. There was definitely a bump in the numbers related to the immediacy of the primary schools reopening, but it wasn't that bad. But they weren't ever expected to be, because it's generally the 0 to 4-year-olds and then the teenage groups who would be the main drivers still with the new variant as well.
Thank you, Paul. And we have 2 questions from Ronan McGreevy of the Irish Times. So I think I'll just put them both together. So one is, what does ISAG propose as an alternative to the government's reopening strategy? And also, can ISAG give a view on the HBSC figures stating that there were 262 COVID-19 cases in a year related to outdoor transmission? So there's 2 questions there, either or both of them. Maybe the alternative, Jerry's raising your hand. Go ahead.
Thanks, Aoife. I think there's so much could be done just with little things, because it takes so much work to keep a virus contained, it takes just a little bit more work to eliminate it. So these trajectories have like severe tipping points, but in both directions. So it wouldn't take more than a nudge to get us back onto the shrinkage rates we knew before. Things that you can do different. First of all, decentralize the whole effort. Everybody in the entire response effort should be associated with a regional public health team. Those regional public health teams should be led, their leaders, the public health doctors, should be local celebrities. They should be on local radio all the time. They should have so much resources they just can't sign off on it enough. And at the moment, instead, they're struggling to retain temps while we expand our centralized contract tracing centers. So if you take that, you take the ventilation issues, if we could be a little bit more patient about schools, and if we just tightened up our definitions of essential workplaces, we could be back on track. And then it's a matter of just sticking with it to an end point and staying there, particularly with the vaccines coming. That just makes the whole thing easier. So there's so much to get optimistic about and that we could buy into. And I do notice in the NEFIT letter, they emphasized that one of the big factors in public buy-in is whether the combination of measures makes sense. And at the moment, for people, they're not. We're all trapped with our own 5 kilometers, which can fly in from anywhere around the world, and that's okay.
Thank you, Jerry. On the point of the outdoor transmission, I think Trish Carney can address that one specifically. Thank you, Trish. You've got tons of experience in this area.
Thanks, Aoife. Well, I suppose 2 things. So the first thing to say is that outdoors is definitely a much safer place to be. I've been saying this from the start, outdoors is a safe space. In terms of the actual percentage, we need to be careful with what we do and what we're doing with the data that's available to us. We can only analyze the data that's available. To a certain extent, we can only measure things that are measurable. And one of the problems with the way that we report on transmission and transmission chains is, for example, that it's much easier to know if someone passes the virus on within a household. And so we see this very large proportion of cases being attributable to household transmission because that's where we can find it. And so I absolutely don't want to negate the importance of outdoors. And we've heard already from Gabriel that, we really need to think about air and the fact that COVID is airborne and utilize all our expertise in thinking about how we make spaces as safe as possible. But I would caution how we interpret the numbers that are available to us. We see a similar problem with the proportion of cases that are attributable to travel. The reality is that we live on an island. So, you could say that 100% of cases are attributable to travel. So just wanted to mention that as well. Thanks.
Thank you, Trish. So it's as ever, it's really important to be collecting good data and complete data as complete as possible. Tomas, could I ask you as well to just also answer the question in terms of what we would propose to be doing differently from the government's current strategy?
Well, I suppose the only problem with the current government strategies is it seems to be doing everything half-heartedly. Jerry Clean commented on how we should be supporting public health on the ground. When you think about strategically what one needs to get control of the virus, to have an aggressive suppression scenario, we need to get the cases down to very low numbers. We need to prevent new cases from coming in, and then we need to be able to respond to cases as they come in. The first is we need to have a more effective lockdown. This lockdown has not been as effective as the first one. Everyone knows this. And part of the reason for that is it's a more transmissible variant. But part of the reason is also because we haven't been taking this lockdown seriously enough as a society. Now, it works in Cork, it works in Kerry, it works in Kilkenny, and works in about 10 other counties. So we know that this lockdown can work, but there are differences between counties. And it's likely not because of the behavior of individual people in those counties. It's because of systemic differences in how we're doing this lockdown. We all know there's too much traffic. We all know there's too much work in the workplace, including in the public sector, that doesn't need to be happening. And there are high-risk work environments that are open and are contributing to transmission around them. So the solution would have been back in January, and is still the solution now, to have a more efficacious lockdown, which means a shorter lockdown. And of course, people respond to this with a certain degree of caution, because a lot of people are restricting themselves and their families as much as they possibly can. And I don't think anyone expects those people to do anything more. I don't think anyone here is talking about severe curfews or greater restrictions than a lot of people are already experiencing, but to make them more effective by ensuring that a greater proportion of society can restrict their movements as much as possible, so that we can get case numbers down. And frankly, part of that is to take a large degree of caution with respect to opening secondary schools over the coming months, because we've known that even with the previously existing versions of SARS-CoV-2, that teenagers transmit the virus just as much as adults. And certainly with the B117 variant, schools are going to contribute to the community. So having a focused lockdown with targets in mind that bring cases down on a county by county basis through green zones is one thing that I think we should be doing differently. The other is mandatory hotel quarantine from all travel origins, including the European Union and Great Britain, as NEF recommended in June 2020. That's still necessary. We eliminated the first wave of the virus. We never got to zero COVID because we always had some cases, but we did eliminate the first wave. The reason we didn't see zero COVID was, as we eliminated the first wave, a parallel second wave was preceded by travel from abroad. And this has been empirically shown to be the case by the genomic analysis done by Paddy Mallon and his team. All of the second wave SARS-CoV-2 in Ireland was seeded by international travel. There are variants that were not here during our first wave. So not only did we know that we had an effective lockdown one, but lockdown one eliminated the virus here. So we can do that again, but we have to this time keep the virus out, including keeping out new variants that of course can be more transmissible or vaccine resistant, as we discussed. And the third thing, of course, is proper contact tracing going back 10 days. So we are not only missing a large proportion of the cases in the country, in the sense that at least 20% of cases at any given time seem to be community transmission, which means mystery cases. Even the cases that we're identifying, we need to know the root tree of where those transmission chains are coming from. Because we don't know the root of where cases are coming from, then we don't know why different counties are doing things, are performing differently. So those are concrete things that we can do and that we have done in the past in the case of an effective lockdown. So we know we can do it to a large degree of success, or that other countries have done successfully and are doing successfully with huge results and rewards. We are dealing with each of those topics with crush lockdown, with contain travel restrictions, and with chase public health measures. We're doing them all in a very perfunctory way. And as a result of that, we're getting no rewards, we're getting a very long lockdown, and we're exposing ourselves to risk of new variants. So that would be a summary of the concrete things that we can do. And I think it's fair to say there's widespread public support for all of these measures, because everyone would like a shorter lockdown. 90% of people want mandatory hotel quarantine. And although one generally doesn't poll how much people want to support our public health physicians, we can generally assume that the public are very happy with us doing so, and with doing everything we can to change the way we're managing that aspect of things. And I think it's important to remember that in January, when many people were advocating for a zero COVID situation because of the third wave, so there were some defeatists thinking about this, saying that it would be a 4-month lockdown, which it wouldn't have had to have been even then, because Melbourne had a 4-month lockdown. Well, and they got to zero COVID. Well, with the current situation, we're going to have a 5-month lockdown, minimally. And with the current strategy, it will not get us to zero COVID unless we change things. So I think that even though the story is changing very much with vaccination, vaccination is not going to be a silver bullet. Vaccination makes elimination easier. Elimination makes vaccination easier, which is a very important thing to remember. But the current approach, what is most worrying about the current approach today is, as Jerry Killeen pointed out, the NEFIT letter only considers scenarios where we're going to have some kind of a fourth wave, ranging from a fourth wave that would be a very minor fourth wave of the level of our second wave, or potentially a much more significant fourth wave with a lot of long COVID and significant ICU admissions and significant death. And even with successful vaccination over the next 8 weeks, that doesn't completely remove the risk of that fourth wave or the damage that the tail of that fourth wave will do. And the exposure to a fifth wave either being caused by the Brazilian P1 variant or another variant, or a fifth wave just caused by another cycle of lockdown and restrictions, because we won't have significant vaccination to protect us from a fifth wave before August.
Thanks, Tomas. And in that, I think you answered a few other questions. I'll just summarize quickly, because there were people asking, would a zero COVID approach or the government's current strategy get us out of lockdown faster? And indeed, the significant main attraction of a zero COVID approach is that you get out and stay out of lockdown faster. And people also asking about, will we be in these restrictions until the vaccine rollout is complete, and when will that be? And indeed, unless the government does something different, that is what they have decided for us, that we wait at home until everybody is vaccinated, rather than taking a more aggressive approach to eliminating the virus and getting us back to normal. There's a question here about the second generation vaccines, and I think I can address this one to Jerry Killeen. So they say the figure of 6 months has been given for the production of a new vaccine to tackle any new strains. Could this be less, given the platforms and the technology is already there, and especially that the adaptability, the versatility of the mRNA strategy? And maybe you could talk generally about the second generation vaccines and some of the prospects for the future there.
Sure, thanks, Aoife. I think we need to distinguish between a second generation vaccine, which is polyvalent and immunizes you against multiple antigens, versus a tweaked first generation vaccine. So it's where you've got a single antigen and you just change the sequence according to what's coming. Now, that tweaking works for flu because it's got a much lower reproduction number, a less than 2. So and it goes through annual cycles, and so you've got time to respond. That's not true of something with a reproduction number of 6. P1 overwhelmed Manaus in about 8 weeks. And there's nobody can tweak a vaccine and scale it up that fast. So but I was so glad we got on Anne Moore and Liam Fanning, and they explained to us like what real second generation vaccines will bring. And that's, kind of a robust situation, which answers the Taoiseach's question about, what's our exit strategy? Well, that's our exit strategy, from things like mandatory hotel quarantine. But, that's 2022. That's well into 2022. It's miraculous technology, but it's not going to come faster than that. In the meantime, so that's the long term. So I'm very optimistic about the long term. I'm worried about the short term and the fourth wave. And I'm outright scared about the medium term and a fifth wave driven by variants. So, I think we all need an elimination plan just for peace of mind, not just so that we can have a decent summer and a decent autumn and a decent Christmas, but also we don't have that worry hanging over our heads. And I can't speak for other people, but that's really starting to eat at me. It is just good old-fashioned fear about the future.
Thank you, Jerry. Ivan, I think you wanted to come in.
Yes, I just wanted to come back very briefly to this question of what would ISAG do differently. without rehashing all that has been said, I think the answer to what ISAG would do differently is literally hiding in plain sight. We would, in the middle of a public health crisis, a public health emergency, we would apply core public health concepts and principles that have been developed over the last 100 years at the level of efficiency and granularity that is needed. I mean, how difficult is it to grasp that we need hotel quarantine for all incoming travel in the midst of a pandemic? How difficult is it to grasp that we need to resource our regional public health departments and treat our public health specialists as consultants leading multidisciplinary teams? Like I'd say to the journalists listening, how difficult a concept is that? I would also say that ISAG isn't at loggerheads with NPHET. I mean, NPHET have been calling for mandatory hotel quarantine since last May. So when the government keeps saying we are following the science, that they're selective in the science that is being followed. And essentially, our strategy has been to manage COVID via a committee, as opposed to having the appropriate technical expertise brought to bear on the problem at the required level of efficiency and granularity. And the final thing I would say is I would call on NPHET and on Philip Nolan and the NPHET team to share their data and their models with the wider modelling community, because the more people that are looking at these models, the more insight we can glean from them.
Thank you, Ivan. And I think that last point is a very simple one, a very simple ask, and there's really no excuse for the data not being shared, because if the data is shared, then various people around the country with all different kinds of expertise can analyze those. When we talk about models, they are saying if people behave like this, then this will happen, and we can have different kinds of models. Some of them might be more realistic than others, have different kind of parameters, and we can see and scrutinize and criticize. It doesn't mean that a genius idea will come from an ordinary member of the public or from a member of the public health community who isn't on NPHET, but at least it allows us all to rigorously scrutinize the ideas and to look at that. There's no reason I can see not to release those data. They can be totally anonymized. It's nothing to do with private information. There's a very stark question here, but one I think that it is right to the point. How could we be at risk of a fourth wave while we're still in a level 5 lockdown? And I think it is a very important question. Who would like to take that one first? Gabriel, I think, was it? Did I see? Yeah.
Yes, and there is something worth explaining here. Although vaccination is a great thing and it's doing very well at helping those who are at highest risk, the elderly and those with serious underlying disease, there are very substantial numbers of people who don't have high risk levels but are at moderate or low risk. And if we do let the virus transmit by lifting restrictions, continuing to allow personal travel in and out of the state untrammeled from very many parts of the world, and if we don't clamp down on it at a local level the way we should do, well, there is every reason to expect that, particularly if we get any variants, that there will be an upsurge in cases. So those people at very high risk will be well protected unless we get variants that can dodge the vaccine to a greater or lesser extent. But a lot of those people at moderate and low risk will get the illness if there's a big surge. And that means that some of them, unfortunately, will get very seriously ill, end up in hospital, and some will die. So it's entirely possible to have a very substantial surge, even though we've protected a lot of the people that are at the absolute highest risk. There are plenty of others who will be affected.
Thank you, Jerry. There's a couple of questions just on data and statistics around the country that I'd kind of merge. One was asking about the trajectory since Christmas, early January, how we had this really high case number that came down quite dramatically, and then there was a bit of a blip. Why weren't NEFIT reacting promptly? Why did they not react to that and see what was happening there? And a question from the same person asking also then about some of the regional differences in the country, and what might be different about Dublin. Is it the fact that this is where the airport is located as opposed to or the main airport is located? So two questions there, but generally to do with the data. So I think maybe the first one, with regard to what happened in January, maybe Paul, you could give a quick answer to that one.
Yeah, sure. In January, what we saw was a near elimination of the old variants over time. It just we did such a better job than April. I suppose we had masks and all these additional tools and we were very good in the first few weeks. It was comparable, not quite to last April, but not a million miles away. But B117, that wasn't sufficient. We probably did need to go the full way to last April type thing to see the thing there. B117 has been pretty stable, not much drop in it since just after December. So I suppose there was an extra family boost that dropped off, and then we're just left with a stable value that hasn't really changed much. We're just holding on exactly. We've seen in the travel data that lands how many more travel related cases there are per imported case. So that would be just the first degree contacts. How many people are directly affected from imports compared to what we would have seen before, where it was more of a slow trickle that would spread throughout the community. Okay.
Thank you, Paul. And yeah, it is important, I think, to recognize the difference in what's happened to the old variants compared to B117, that since January, totally stomped out, it seems, the older variant, the one that came in, last summer, effectively. And it's the B117, our current lockdown, because it's not as effective as this time last year. It's only keeping B117 steady, which is very worrying, because it means that any release was sent back into growth again, which is not a situation we want to have to face into. So I'm going to try and wrap up in a few minutes, but I'd like to ask Yanir Maryam to give a few comments on the general discussion.
So I want to go back. Anthony said there's a choice, and we talked about all kinds of choices that would be done differently. The main thing to realize is that there's a difference between passive acceptance and active understanding that we have the control, not individually, but collectively, of what will happen. And it's the recognition that we have control that leads to a need for a strategy, and given that strategy to accomplish a goal. So if we have the control, we should take advantage of it. And that's really the crux of what has been presented, I see, today. And by the way, it's the same story around the world. It's the recognition of the ability to control, and that every action that is done collectively by the society, by decision making, is actually influencing the trajectory of the outbreak. So again, once we have the control, we should make the decisions that enable us to get to the objectives that we want.
Thank you, Yanir. And I think that's a nice point on which to end, and we're just keeping this just within the hour. So thank you very much to everybody who's contributed to today's discussion. Thank you very much to our attendees and the very interesting questions and very important questions. We welcome that, and I think this works best with good questions like that. So thank you very much. I think the message to take is that we do have choices ahead of us. We've always had choices throughout this entire pandemic. We have never been forced to just accept this. We've always had the choice, and it's a matter of making those choices. And everybody in the country, as far as I can see, everybody is doing what they can, but there are some people who are not being enabled to do what needs to be done. And that includes supported isolation, that includes being able to take paid sick leave when it's necessary. These are basic things that are still missing a year in. We're still not properly resourcing our public health units. We're still not doing some basic public health measures that are as old as the hills and that work well. And because of those failures and because of not making those choices, we're imposing maximum misery on people in the country. And this, and it's time that we changed that, and that we as a country got ourselves out of this situation and into a more comfortable life as we wait for our turn to get the vaccines, which are a wonderful marvel of science that we all enjoy. So thank you very much, everybody, for your participation today. And thank you for your attention, and see you next time.